What is Friedreich's ataxia? Friedreich's ataxia is a rare, autosomal recessive neurodegenerative disorder that causing progressive damage to the spinal cord, peripheral nerves, and cerebellum, leading to impaired muscle coordination ataxia. The condition typically manifests in childhood or adolescence, with initial symptoms including difficulty walking, loss of balance, and poor coordination. As the disease progresses, it can also impact speech, vision, and hearing. Many individuals with Friedreich's ataxia develop scoliosis, diabetes, and hypertrophic cardiomyopathy, a serious heart condition that is a leading cause of mortality in patients. A 15-year-old girl comes to the office with gait instability. Since age 12, the patient has had mild weakness and clumsiness in her lower limbs that have progressed. She has to hold on to the railing when walking downstairs due to several recent falls. Physical examination reveals kyphoscoliosis, PS cavus, and bilateral lower extremity ataxia. Joint position and vibration sense are also impaired. Further evaluation reveals that she is suffering from an inherited disease. This patient likely has Friedreich ataxia, and she is at greatest risk of dying from cardiomyopathy. Friedreich ataxia is an autosomal recessive, trinucleotide repeat disorder on chromosome 9 and gene that encodes frataxin iron-binding protein. It leads to impairment in mitochondrial functioning. Friedreich ataxia typically presents during childhood adolescence with progressive gait ataxia due to degeneration of the spinocerebellar tracts, and impaired joint and vibration sense due to degeneration of the posterior columns and dorsal root ganglia. Lateral corticospinal tract involvement may result in spastic muscle weakness and a positive Babinski sign. Other characteristic features of Friedreich ataxia include hypertrophic cardiomyopathy, skeletal abnormalities, for example, kyphoscoliosis, PS cavus, and diabetes mellitus. Complications from cardiomyopathy, for example, cardiac arrhythmias, congestive heart failure are the most common cause of death. Marfan syndrome is an autosomal dominant connective tissue disorder associated with aortic dissection, mitral valve prolapse, ectopia lentis, and skeletal findings, for example, pectus excavatum, arachnodactyly, joint hypermobility. Neurofibromatosis types 1 and 2 are autosomal dominant disorders. Neurofibromatosis types 1 is associated with optic gliomas, whereas neurofibromatosis types 2 is associated with bilateral acoustic schwannomas and meningiomas. Autosomal dominant polycystic kidney disease usually presents in adults and is associated with hypertension, renal failure, and intracranial bleeding due to ruptured barrianeurysms. Wilson disease hepatolenticular degeneration is an autosomal recessive disorder associated with liver failure, movement abnormalities, and psychiatric symptoms. Friedreich ataxia is an autosomal recessive condition that presents during childhood adolescence. It presents with progressive gait ataxia due to degeneration of the spinocerebellar tracts and impaired joint and vibration sense due to degeneration of the posterior columns and dorsal root ganglia. Other features include hypertrophic cardiomyopathy, the most common cause of death, skeletal abnormalities, for example, kyphoscoliosis, PS cavus, and diabetes mellitus.